Hello, and welcome to the Health Roots podcast with Dr. Victoria Andarcia. And today I'm super excited to introduce Dr. Jaci York. She's a pelvic therapist who I've learned so much from, and I'm excited for you guys to do the same. So, welcome, Jaci. Hello.
Thanks for having me.
Yes. So, before we jump into the podcast and the questions that I have for you today, can you tell us a little bit about yourself?
Yeah, absolutely. So I have been a pelvic health physical therapist for going on 11 years now. I am a board certified pelvic health physical therapist as well. I absolutely love what I do. I love my patients. I treat and have treated all the spectrum of pelvic health conditions. So right now I'm primarily treating pelvic pain, pregnancy, and postpartum. That's kind of my bread and butter of my practice currently, but I treat men. I have treated postmenopausal women. I've treated the whole gamut of pelvic health conditions over my career. And it's a topic I am passionate about. And I feel like even though social media, it's getting a little more well-known, people are still not really very familiar with pelvic health physical therapy. So yeah.
Yeah, I would say I was not familiar until I joined a group of different medical professionals, and I learned through there exactly what it was that pelvic therapy can do.
Mhm.
So for someone who might not know
Yeah.
exactly what pelvic therapy is, how would you explain that?
Yeah, it's a very loaded question because we do a lot of things. But I mean, basically, the easiest way to explain it is if you have issues with pee, poop, or sex, we help with that. And we also help with pelvic pain, which can incorporate not just pain in like the genital area, but also the tailbone area, your like glute pain, hip pain,
Mhm.
things like that can sometimes have a pelvic floor driver as well. And so, as a pelvic floor physical therapist, if you have dysfunction in any of those pelvic areas, we assess the body head to toe, specifically more the trunk, pelvic area, hips, and find where the dysfunction is coming from that's driving it. And that's basically what we do. We're problem solvers, and we try to figure out where that dysfunction is coming from, and if it is a musculoskeletal cause versus a medical cause, for instance.
Okay. And what are some common symptoms that people have that you've seen, but that they would not associate with a pelvic floor issue?
Yeah. Um, I would say in the pain category, for instance, pain with sitting, people don't think about that as a pelvic issue, but a lot of times it can have a big pelvic floor driver. Hip pain, especially if you have had imaging and it's fine, and you've been to maybe an orthopedic physical therapist and the exercises are helping a little bit but not working. The pelvic floor and the hip are very intimately connected, and so they very much can drive dysfunction in each other. So hip pain can be one. Lower abdominal pain also. Also, we know there's a lot of medical causes for abdominal pain.
Yeah.
If you don't have those issues, though, there are actually the pelvic floor can refer to the lower abdomen, and or you can have fascial tension or even abdominal tension that can create pain there as well. Um, Also, dysfunctional voiding patterns, constipation is a big one that I see a lot. And when I think of constipation, there's different, depending on who you talk to, people have different definitions of constipation.
Mhm.
You, as an integrative physician, probably have it more in what I'm thinking is you should be going every day and having a
Yeah.
sizable bowel movement, not every second, third day, which some
Right.
people would define that as constipation. No, you should be eliminating, voiding every day, sizable bowel movement. And if you're not, there can be a lot of reasons for that. Obviously, diet, which I know you address with people a lot, but there can also be an outlet dysfunction issue, meaning maybe your pelvic floor doesn't know how to relax or it's uncoordinated, and so therefore you're having worsening constipation because of that, or issues emptying your bladder too. Those are kind of some biggies that I think people don't think about. If you have trouble going to the bathroom, if you ever feel like you have to strain to go to the bathroom, then there very well could be a pelvic floor dysfunction, or if it hurts to go to the bathroom. It should never hurt to have a bowel movement or to urinate.
Okay.
Yeah, those are some. I could keep going on, but if you have any specific areas you want to branch off, let me know.
Yeah, no, and I think those are really helpful because I think we often forget about the pelvic floor.
Mhm.
right?
Yeah.
So, and I have patients that they'll talk to me about constipation and I'll be like, you need to see a pelvic therapist.
Yeah.
And yeah, it doesn't always click, right? Like why would I need to see
Why
it?
would it? Right. Well, your anal sphincter, I hope you're okay with me talking
Yeah.
bluntly about anatomy, and your urinary sphincter are part of your pelvic floor. So if there's dysfunction there, you're going to have problems eliminating. You know what I mean? So,
Yeah. Yeah. No,
but
that's helpful.
yeah.
Okay, so my audience, like I was saying before, is mostly childbearing age or
Mhm.
postpartum.
Yep.
So for someone my age without children, would
Mhm.
you say that pelvic therapy can be helpful?
Absolutely. For any of the reasons that we listed before,
Hmm.
um, or if you're having pain or discomfort, dysfunction during sex, it can be helpful for that as well. Um, Baseline sex should not hurt. And if it does, then you need to see, potentially an OB, Dr. Andarcia, or a pelvic floor therapist, because there's a lot of reasons why that can happen. And often there can be a pelvic floor reason for that. A big one too that people don't think about, especially in the more athletic population, also, which a lot of women around childbearing ages try to exercise a lot, right? Go running, go to F45, CrossFit, all the things. If you are leaking with that at all, um, if you're leaking anything, even a couple drops of urine, then there's a dysfunction going on in your pelvic floor and or core. So that's another reason to go to pelvic therapy. In the childbearing years realm, um, one thing that I find important, so everyone has a different way that they want to deliver, right, their baby. So some people are totally cool with, whatever happens, happens. I'm good with the epidural, all the things, and that's totally fine. I do have a lot of people that I see in my practice specifically that want to do natural childbirth, and pelvic floor therapy is extremely helpful for that. If you don't know how to relax your pelvic floor, it's harder to get baby to come out, right? So the goal with delivery, vaginal delivery, and this is even if you have an epidural too, is the pelvic floor. You just want it to relax and get out of the way. The more tense it is, the more likely you're going to have potential pelvic floor trauma during delivery. And so getting that pelvic floor really nice and relaxed and open in preparation for delivery can be really, really helpful. Because people don't think about that. A lot of people think about the postpartum follow up, but not the before, even before baby or during pregnancy part of it.
Okay, and so like leading into that postpartum,
Yeah,
it's something that we don't really do a lot or make it part of like the mainstream medical practice. But I know that there are countries where it is part of the postpartum maternal care.
it should
So
be
would you have
standard for sure.
to? So and so why would that be?
There, you know, having a baby is wonderful. It's a great, wonderful process and time in life. It is very hard on your body. Uh, I have had three, and I've had different issues after each one, depending on how my delivery went and things like that. So, postpartum, so if you think about just the changes that your body has to go through, how much your abdominal wall has to stretch, how much stress is on your pelvic floor carrying the weight of your uterus, baby, placenta, it's a lot of stress on your pelvic floor, even if you don't have issues per se, like pain or seemingly you have a really beautiful delivery where there's no tearing or anything like that. um, so so yeah, doing a postpartum follow-up to see how is your core functioning can be really helpful. A lot of women postpartum do have pelvic floor dysfunction, do have diastasis recti, which is
Mhm.
a big one that I treat postpartum as well. And or if you've had a cesarean section, scar tissue adhesion potentially, and or your abdominal wall can be really shut down after having baby. And then if you go back to trying to, 6 weeks, you're good to go do whatever you want. No, your core is not ready to just do whatever you want. So get building up that foundation, because you just did an amazing thing for those past 10 months, and then delivering, no matter how you deliver, it's work, it's hard on your body.
Yeah.
So just kind of getting that core back online in a healthy way. I like to look at it as, let's restore your foundation so that you can get back to the exercises that you want to do safely postpartum,
Okay,
or
and
just daily function too.
right.
Yeah.
And you just mentioned the diastasis recti.
Mhm.
So I had a patient that had that, and I don't really know a lot about it. She was just offered surgery.
Surgery should be a last resort. I have never, so there is always going to be that case that it's just not going to resolve, right? And you need
Mhm.
surgery. We all know that that happens in every facet of medicine, right? Like where it's just the natural things are not working, or the conservative treatments are not working.
Mhm.
I have never been able to not help someone correct their diastasis in my almost 11 years of practice. Now, there is a combination, and that being, by the way, the worst case that I saw was a mom of triplets, and I could fit my fist between
Oh,
the muscles and move it back and forth. And we were able to get it back within normal limits. So, a couple of things about diastasis. One is that there should be a natural separation between your rectus abdominis, your six pack muscles. Like some people freak out. Oh, there's a lot of misinformation online. So be careful if you go on Instagram and, and read around, because some people have just bad information out there. There's always a little bit of separation there. That's completely normal. It's healthy. It's meant to be there for a reason. So that's number one. So we want to get it within normal limits postpartum, but that's still a little bit of separation. You don't want a big separation, and you don't want poor, what we call pressure management. So where it's like doming out or coning, almost like it almost is
yeah.
similar to like a hernia, I guess is what I would, the closest thing to compare it to, because then it's putting, how do I say this? Your pressures in your abdominal cavity then are not well equalized if your
Mhm.
core has that dysfunction. And so it can put excessive strain to that area when you're trying to do functional things, and eventually lead to other issues down the road, potentially like incontinence or prolapse, or just back pain because your core is not functioning like it should,
Yeah.
but there, it's very fixable postpartum. It does take some work and time. So how I treat it personally, I think that manual therapy, right, postpartum specifically, I do something called visceral manipulation that helps those, that area approximate really, really well. So a lot of times you have, in my opinion and what I've seen in practice, fascial adhesions from that overstretch of the abdominal wall. So you kind of have to do some release work first and then get the core to wake up again, because when that muscle is so overstretched during pregnancy, it doesn't just kind of snap back online all the time. You have to kind of wake it up and retrain it, which then helps the diastasis to come back together and you to have a more solid core.
Yeah.
Because it's basically a defect in your core.
Yeah. No, thanks for explaining that because I think it's just important to know, just like everything,
Mm-hmm.
that we don't always know in a hospital setting or in a clinical setting that there are
Yeah,
other options for, certain things. So that was a really good explanation for that. And what are the most, I know that the one I hear the most after
mhm,
pregnancy, right, is like incontinence. But is there anything else that we might not really realize is related to pelvic floor after pregnancy?
absolutely. Incontinence is a biggie for sure, and not just leakage, but also urgency, like urinary urgency, like feeling like you have to go all the time. Now, I say that with a disclaimer that if you're breastfeeding and chugging a ton of water, you're, which you should, you're probably going to pee, right? A lot
Yeah.
more. But that feeling like you got to go all the time, or that urge to get to the bathroom, that's one. One that's kind of yucky, or two that are kind of yucky that people don't want to talk about, are fecal issues. So if you're having pain with bowel movements or issues with bowel movements postpartum, or even leaking a little bit
Mhm.
in that area postpartum, even gas, so gas or fecal matter, that could be absolutely a pelvic floor issue. I see that often with people who have higher grade tears um,
Mm,
during delivery. If you have hemorrhoids that are bad and not healing, that can be
yeah.
pelvic floor driven, believe it or not. Because if you have a lot of tension in that posterior pelvic floor, it's squeezing them all the time, and
Mm,
they can't heal, essentially. And then it gets worse because then you're having to push a bowel movement through that tight pelvic floor, and it's putting more
yeah.
stress on the hemorrhoids type of thing. That's another big one. And then the diastasis that we talked about as well. And then any pain too. Like you shouldn't have pain with sex postpartum. Well, once your hormones normalize postpartum, which we can talk about in a minute too. So it can be a pelvic floor issue. A lot of these can be pelvic floor, but there can be some other things going along with it too. But yeah, all of those are not normal. So if they're happening, especially the further postpartum that you're getting, So, because I have some people, I do want to specify that they'll call me like, well, I had my baby 3 years ago, but I still have this issue. It's because you never healed properly. We need to get you the proper treatment. So just because you're okay, seemingly okay right away and things kind of heal, if they start to rear their ugly head again, then it might be an indication that you need to see your doctor and or a pelvic floor physical therapist.
Okay. Yeah, I was going to ask you that. Like, what about the people who never see a pelvic therapist? But yeah, so okay, so it can come back to bite
Well,
you.
once postpartum, always postpartum, right? So your
Yeah.
body is forever different after you've carried and grown a human. So it's never
Yeah.
too late.
No, no, I would no. Okay. And so now that was like the next question is how do hormonal changes throughout a woman's life affect pelvic floor?
Absolutely. So um, two of the biggies. So perimenopause, menopause is more well known.
Right.
When your hormones deplete from a pelvic floor perspective, so musculoskeletal perspective, especially as women, we have estrogen receptors all over our body and including in our pelvic floor. So when those deplete, you can kind of get a lot of atrophy of your pelvic floor and of your tissue down around your vulvar area, which can lend to what's called genitourinary syndrome of menopause, where you get urinary symptoms or pain with sex is a big one. It's kind of that sandpapery, yucky feeling, like because it feels dry. So
Right.
that's a big one. There is, and actually the we were talking about before, the genitourinary syndrome of lactation is also something that is not as widely known, but it's absolutely a thing. We've known it's a thing for years. They finally slapped a name on it within the last year, just so we're on the same
Oh,
page. Like this is a very newly named condition. It does the same, similar to what happens during perimenopause, early menopause, where your estrogen is very low because of lactation, right? And so you get sometimes the urinary symptoms or the pain with sex while lactating. And so that can be something that can make you feel like you're not healing properly postpartum, but it's actually a hormonal issue. There can be a pelvic floor component to that, absolutely. But sometimes you actually need to go see your physician for some, hormone therapy to help with that.
okay. And so touching on the hormone therapy, because I think that that's something, in that condition that is not very commonly used, but even in the perimenopause and menopause state,
Mm-hmm.
the hormonal therapy, because so one thing that I see a lot is chronic UTIs in perimenopause and menopause, right?
Mm-hmm.
So I use the vaginal estrogen because
Absolutely.
it's been shown to help. But can you comment on that? Because I think that that's still, even women who are on estrogen therapy or hormonal therapy, they're not using the vaginal estrogen. So it's
Right.
just like we're missing a really big piece there.
Absolutely. So I can comment it from my perspective as a pelvic floor physical therapist, someone who doesn't prescribe the hormones, but I see a lot of vaginas. Okay, so like, so the systemic hormones, yes, that's going to help a lot of different things, and I'm you'd be able to talk more about that. I apologize than me. So the local estrogen, though, because it does help the local tissue in that area, I feel like I see the changes of women who are on systemic and don't have the local and versus have the local estrogen. It absolutely does help to plump up the tissue down there, make it more pliable. And also the localized estrogen, it does help with your flora, vaginal flora and things like that as well. So that does help to decrease UTIs and things like that.
Okay. And then just going back, because I just
Yeah,
remembered
absolutely.
it should be important
Yeah.
to, um, on the is that something that, like, if I went to my gynecologist, let's say, in my postpartum period and I'm having symptoms,
Mhm.
uh, is it something widely known that maybe the gynecologist would be open to, or is it that new that maybe we have to?
It depends on the gynecologist,
Okay.
if that makes sense.
Yeah.
There I think this is just across the board in medicine and physical. Some people keep more on top of things than others.
Hmm.
Um, I would say that it's not abnormal to get topical estrogen postpartum, especially if you're having issues with delayed healing of like scar tissue and things like that, or if you say specifically pain with sex.
Hmm.
then a lot of times they will do the topical estrogen, especially because it doesn't really lower your milk supply with breastfeeding. I don't know that that specific syndrome, or if you went in saying I have urinary symptoms, that every single doctor would say, oh, you need topical estrogen for that. Does that make sense?
Yeah.
So I think it's more if you say I have pain with sex, or like your scar tissue isn't healing well, they would think of it more. But I have seen where it's more just the urinary symptoms, but it's not correlated. Does that make sense?
Yeah, that makes
Even
sense.
though it should be. Even my OB, who I love dearly, I went in and was like, I need this for genital urinary syndrome of lactation, and she's like, okay, so let's get you some so you don't hurt while you're having sex. I'm like, okay, but it doesn't hurt while I'm having sex. I'm having urinary urgency. She's like, okay, but just in case, because it probably will. And I was like, okay, as long as I get what I want, I'm fine. you know,
Yeah, no, that is there is a lot of differences, and especially where you trained and things that you believe in
correct.
medically. But you did say something, and not like so. You've mentioned chronic pelvic pain, like or pelvic pain here quite a
Mhm.
bit, and I know that there are people who have chronic pelvic pain.
Yes.
And I think it's one of those things that, at least in my former training, it'd be
Mhm.
like, wow, put this person on an antidepressant or like something.
Right.
It's not very commonly understood. So you just kind of throw whatever you can at them and call it a day.
Right.
So now that I have you here, how would treatment look for someone like that? Like, what is that? What is going on there? Is it something that they need an antidepressant for, or can we explain it in a in a better, helpful way?
So that's a great and also very loaded question, because chronic pelvic pain
As a
encompasses a
spectrum.
lot of different conditions, everything from endometriosis
Mhm.
to interstitial cystitis to just overactive pelvic floor,
Mhm.
pudendal neuralgia. There's a lot of different reasons why people have chronic pelvic pain. Um, So some people need to be on an antidepressant and some people don't. Every single person with chronic pelvic pain, whether or not it's driven from a medical reason, for instance, endometriosis, right? That's a medical diagnosis.
Yeah.
A lot of people with endometriosis also have overactive pelvic floor and pelvic floor guarding patterns, which are making their pain astronomically worse.
Mm.
Does that make sense? So,
Yeah.
um, every single person with chronic pelvic pain, hands down, just should have a pelvic therapist evaluate them at some point, because more than likely there is a core pelvic floor driver to their pain, which is exacerbating it. I have, I'm biased because obviously you're coming to me because you have an issue, right? But I've never seen someone with chronic pelvic pain, even if they had a medical diagnosis, that didn't have some form of core dysfunction.
Right.
Does that
Okay.
answer your question?
No, it just makes sense. And I mean, I feel like the more we talk about this, the more I'm just like, everyone needs to see a pelvic therapist.
There's a lot of
Maybe.
people that do. And a lot of men that do too, believe it or not. And I have treated men that don't even know they have a pelvic floor. So,
Yeah, I mean, I can see that. And like I said, I've learned a lot with you. So, I mean, it's been very enlightening. Okay. So, is there anything else that that we haven't touched on, that as a pelvic therapist, you're like, I want to kind of clear things up on this, or this is something that people should know? I know there's
goodness.
probably a lot, but just something that you see commonly that people need to.
Um, that is a again loaded question, but I would say if you're having, I don't know how to say this without sounding, so if you're having these pelvic some of these pelvic symptoms that we've talked about, and you're not being referred to pelvic floor physical therapy, I think it's important to know that you can advocate for yourself. This is a big thing. And seek out a pelvic floor physical therapist on your own, depending on what state you're in, where you are. Like Florida's direct access. You don't have to have a referral from your doctor to come to pelvic floor physical therapy. But people are being told, you know, no, you don't need that. I had a patient recently, and she's had interstitial cystitis and pelvic pain for years. And unfortunately, her urologist thought pelvic floor physical therapy was just doing Kegels, and it's absolutely not. And in fact, we often don't do Kegels. There's a small portion of the population that I prescribe Kegels to because it's appropriate. Most of my patients, they don't do Kegels. And so I think in that scenario with the patient I was just talking about, she was told for years she didn't need pelvic floor physical therapy. Well, she finally sought it out on her own, and her pelvic floor was one of the tightest, most tense pelvic floors I have ever seen. And it was absolutely driving a lot of her urinary symptoms and pain symptoms. So I think the biggest takeaway I would want to say to people is if you're not getting the answers that you feel like you need, seek
Mhm.
out a different opinion or seek out a pelvic floor physical therapist, and even there's a lot of like my practice that do discovery calls, talk to them, see if you can set up an appointment or even a short virtual session. And do I sound appropriate based on what I'm telling you?
Yeah.
Because I have so many people that have suffered for years and they talk to me during a discovery call and they just feel so validated because they're like, for years, people have not known what to do with me. And you knew exactly what could be driving my symptoms. So don't be afraid to advocate for yourself and don't be afraid to get another opinion.
Okay, yeah, I do think that that's really important to mention because
Yeah.
it's also not part of our medical training.
Yeah.
Like, I didn't know pelvic therapy existed until I met you guys.
It's not widely known, and even people that know about they don't really understand what we do a lot of times. So I've done a lot of educating throughout my career on that because again I started 11 years ago, and my god, back then people had no idea. You know what I mean? It was not that it didn't have all the Instagram trendiness that it has now, for instance. So yeah, I think if you are think that you might need pelvic floor physical therapy, talk to a pelvic floor physical therapist who is trained and knows, what they're talking about because they're going to be able to answer for you. And everyone's a little different in how they practice, but I know for me, if you sound like you need pelvic floor physical therapy, I'll set up an appointment, but I'll be very honest. If I don't find pelvic floor dysfunction, then I'm going to refer you back to your doctor because I'm like, I don't think this is coming from your pelvic floor.
Right, right. That's
So,
important.
and anybody should be like that as well.
Yeah. And so you started this 11 years ago. Why
Mhm.
pelvic floor therapy? Why did you choose that?
So yeah, so it's funny because when I was about to go to physical therapy school, they make you do all these observation hours, and I knew I wanted to go to physical therapy school, but I was just getting the hours so I can get into school, whatever. And I just happened to shadow a couple days at a clinic where they had a pelvic floor physical therapist, and as soon as I started talking to her, this is exactly what I want to do. I was just fascinated. It was like it's total nerding out. I was hooked. She gave me a bunch of studies to read. There's not very much still to this day great research on pelvic physical therapy, but she gave me the few that she had. And I was just hooked. And I went, which is very rare, especially back then. I went to PT school up in DC knowing that I wanted to be a pelvic health physical therapist. In my class of 35, I was the only one, and everyone thought I was a total weirdo. They're like, why would you want to do that? That sounds so gross. But yeah, but that's what I knew I wanted to do, and so I went right into it. After I graduated, I went right into a training program up in Jacksonville and got my feet wet ASAP and got training, and I love it, and I've been doing it ever since. The field has evolved, it's changed tremendously in the past 11 years for the better, for sure. But
Yeah.
yeah, that's I just knew. You know how something just clicks sometimes, it
Yep.
just works. So that it was one of those scenarios for
Yeah,
sure.
no. It sounds like it was your calling. And I'll say that from the times that I have spoken to you, I get like pumped about pelvic floor therapy just talking to you. I'm like, yeah, this is so cool. I love like just talking to you. It gets me excited. I
I
tell all
love
my
it.
friends about it and I tell my patients about it. I was like, everyone needs to see a pelvic floor therapist.
Love it.
So, yeah, your excitement and your passion for what you do is evident just by talking to you. All
Awesome.
right. So, on that note, okay, how can our listeners get in touch with you or learn more about your practice?
Yep. So I have my website is flourishpelvicpt.com. I'm at Flourish Pelvic PT on Instagram. I'm not super active on
Mhm.
Instagram, but I am there and it has all my info. And then if you Google Flourish Physical Therapy, and I'm in St. Petersburg, Florida. That's where my clinic is located. It should pop up that way as well. And like I said, I do discovery calls. So if you're wondering if you need pelvic floor physical therapy, definitely reach out. I can do a discovery call or a virtual session if you're not local as well.
Okay. And when I put this, I'll put your links in there so people can reach out to you that way.
Yep.
But yeah, this was an awesome conversation. I learned a lot. It was a lot of information, but you know,
Yeah, sorry.
no, but I think it's great. It's great because
I
anybody
actually reined
who,
it in too. I was like, I need to make this short and sweet, and I didn't.
yeah, but anybody who like didn't know what it was,
Yeah,
hopefully they have a better idea and can look into it now if they need it.
hopefully, yeah.
Yeah. Well, thank you so much, Jackie. I really appreciate you being on the podcast today.
Appreciate you having me. Thank you so much.